Go ahead.
You just said that leadership starts at the top when it comes to getting COVID vaccines out, but when you describe the messaging on immigration, you're talking about leadership from Ambassador Jacobson and many others getting the word. And
I don't think that's what I said, but
well, you were explaining why President Biden is not out here.
I actually, to be factual, because we're all about facts,
Yeah.
I actually started by saying he did an interview with Univision just 2 weeks ago, and that he would look for opportunities to continue to deliver that message clearly himself, but that there are a number of voices that are important and effective and can be heard in the region, and that we will certainly use a number of voices to communicate directly in the region.
So we've heard from some folks down at the border in Brownsville, Texas specifically, of migrants who are being tested by some of the NGOs down there for COVID. They test 1,700. At least 204 positive tests so far. That's over a 9% positivity rate, more than double the national average. So what is the federal government doing to protect the citizens of a town like Brownsville, Texas?
Well, I don't know where I'm not questioning the data, but I certainly would refer to CBP, and I'm happy to get more specific data.
That's where we're getting
Officially from CBP data on the testing. Well, let me walk you through, because obviously there are a number of categories of individuals who are coming, and this is a question you've asked before, and certainly an understandable question. So individuals who are taken into, and so I'm just going to give you an outline of the testing, into ICE custody. Migrants entering ICE facilities are tested upon intake, and they're quarantined if they test positive. That's one category, of course. Unaccompanied children, of course, another category. All unaccompanied children encountered at the border receive a medical screening by contract medical professionals. That includes a medical assessment or health intake interview. Minor issues are treated on site, and major issues are referred to a local hospital. So when a child is released into ORR custody, they quarantine for 10 to 14 days and receive COVID testing through HHS. Those who are, come into the country and are treated with alternatives to detention, sometimes that's ankle bracelets and other means of tracking. DHS works with city and county leaders as well as public health officials to provide COVID-19 testing and, as needed, isolation and quarantine for families released from Border Patrol facilities. And that's something we've talked about a bit in here in terms of a proposal that was made by DHS and FEMA in coordination with NGOs and local authorities to fully cover and pay for the testing. That up to this point, the governor has declined that proposal.
But based on what you have said before and our understanding of the policy, it's just guidance that these migrants who test positive, many of them are instructed you should go and quarantine and isolate. Does the administration know how many actually do versus how many actually just go off to wherever?
Well, I just wanted to convey, because I know you were asking a good question here, that the very specific processes that are taken for each scenario. And certainly there are, with the individuals who are coming across, alternatives who are treated with, again, noted sometimes ankle bracelets as they come across while they're waiting for adjudication of their cases. Those are the steps that are taken. Those are the recommendations that are made. And I just noted that testing is there's a proposal for testing all of these individuals as they come across. So that's what our policy processes are. But in terms of specific data and numbers, I would certainly refer you to CBP, or I'm happy to talk to them as well.
And do you know if there are any administration discussions about vaccinating some of these migrants who are being held for much longer than normal, or much longer than in previous administrations, to stop the spread in the shelters?
It's a really good question. I would say, obviously, we're focused on vaccinating, eligible Americans in the country, but we do believe that vaccinating as many people as possible keeps all of us safe and ensures the safety of all people living here. But I'm not aware of any plans. We are very focused on addressing and taking steps to address the public health challenges that we're seeing across the border, of course, with the pure number of people, the number of people who are in CBP facilities and in these shelters. We've talked a bit about working with the CDC on guidelines, but certainly with the pure numbers, we need to continue to look at and evaluate ways to prevent this from becoming more of a public health challenge.
And then one other topic quickly. Last night in his speech, President Biden reiterated his goal. He wants a majority of schools open by his 100th day in office. That's April 30th.
Yep.
One day later, May 1st, he says that every adult is going to be eligible for the vaccine. We know that teachers have been prioritized
Right.
everywhere. So why just a majority of schools as the goal instead of a specific high percentage, or say all schools?
Well, first, let me encourage you. You could even go cover it, I bet. The Secretary of Education is having a forum on schools and school reopening on the 24th. I believe it's the 24th of March. There are a lot of steps that are being taken already by the Department of Education. They're issuing a guidebook, a guide of best practices. They're already engaging with schools and school districts. They're requiring that any school that is going to have access to funding from the American Rescue Plan produces a plan within 30 days to reopen their school. The school district does, I should say. So there are a number of steps underway. We, of course, want to have schools reopen and have them reopen in 5 days a week. That's our objective, but it's in the excellent hands of the Secretary of Education, who is, this is his number one priority every day, as the president talked about in his speech.
And last one, would the White House be okay, or could the White House get behind a proposal for schools to remain in session full-time through the summer?
Well, some school districts will decide to do that, and they can use funding from the American Rescue Plan to do that, or to help ensure they can do that. So it's really going to be a decision made school district to school district, and if that determination is made, we certainly support that, but that's part of what Secretary Cardona will be working out with school districts.